and going up the head to the neck and the brain. Right? I'm going to review the blood flow up through the external carotid artery, the brain. I'm not going to redraw. So we have the heart. And I'm not going to label these since you have them on your diagrams from lecture yesterday, but I'm going to draw them and go through it with you. So leaving the heart, we have the ascending aorta. And the first two branches off of the ascending aorta are coronary arteries. Excellent. So we have right and left coronary arteries. And then the aorta bends to the left and posterior. And the first branches off of the arch of the aorta. The first branch, we have three. The first branch is to the right side. Brachiocephalic trunk. And that's going to give rise to two branches. Common carotid to the head, the cephalic part, that's the right subclavian to the right arm. And then left common carotid comes off of the arch of the aorta directly. And left subclavian follows the pathway that we see on the right side. So in our heart models, back in the lab, you were asking if you needed to know those branches off of the aorta for our first heart quiz. Those were those three right here, when we were doing the sheep heart dissection. And the aorta rising out of the center of the heart had multiple branches. Those were some of these. Okay? Then we took the common carotid, and the internal carotid went up into the carotid canal, and the external carotid went onto the face. It gave off a branch, remember, that went around to the
occipital
back of the head, the occipital artery. It gave a branch that comes down the anterior neck, and it goes to the larynx or voice box and to the thyroid gland, superior thyroid. It gives off a branch to the tongue that we didn't deal with. And so the next branch crossed the mandible and did this highly tortured path to get to the nasal
facial
strictures, facial. The next branch goes behind the mandible and supplies the deep muscles of mastication. And it gave a branch that went up through the skull
middle meningeal
and supplied the dura mater and the deep periosteum. So going through the foramen spinosum, we have the middle meningeal artery. Okay. Remember the foramen spinosum at the posterior aspect of foraminal valley. And though it was behind the mandible, that artery is not called the mandibular artery, but the maxillary artery. Okay. And it's supplying branches to the temporalis, to the pterygoids, so some of the nerve structures in there, some of the ganglia, as well as this middle meningeal artery. And then finally, the external carotid artery is going to end on the lateral aspect of the head by giving off a few branches, all of which are known as the superficial temporal artery. Good. Okay. And then we did all inside the brain and everything, but I'm going to leave that up for later. We followed those vessels to the brain as they branched off of the subclavian, and those are we're going to pass through the foramen magnum and fuse to form the basilar. So vertebral, vertebral pass through the transverse cervical foramina and join inside the skull to form the basilar artery, and then we follow the branches of the basilar and the internal carotids as they form anterior, middle, and posterior cerebral arteries. Okay, so that was vertebral. We're getting towards the end of lecture from yesterday. We have the thyrocervical trunk, and it's going to give off multiple branches that supply the base of the neck and over the back towards the scapula. I don't know if you remember the suprascapular notch in the scapula on the superior border. All right, the suprascapular artery that passes through that notch comes off the thyrocervical trunk. Again, you don't have to know all those branches, but recognizing the thyrocervical trunk. And then finally, the last thing we did was to add a descending branch. All of these are going to be the same here too. And you like that one, don't you? JP was in this morning. That one. cervical trunk. Okay? So we'll put in internal thoracic here, and then we're going to come back to internal thoracic in just a few moments when we're done with the subclavian. So subclavian artery on both sides is going to pass laterally across the root of the neck and pass deep to the clavicle. And when it passes on the distal side, the inferior border of the clavicle, it changes name. So again, it's like traveling from along the road in Sacramento, that the road itself doesn't change, the name changes. We haven't turned off of the road at all.
And that's the axillary?
That would be the axillary. So it passes through the axilla, or the armpit. It actually gives off quite a few branches, because it's in that shoulder area. We have lots of vessels every time we get to a joint, like the hip joint, or the knee joint, or the elbow joint. There's a lot of branches around that area. And so the axillary artery has a lot of branches that go to the chest muscles and go to the scapular muscles. But we're not going to name those. I just want you to know this as the axillary artery. Okay? I'm going to just go ahead and write those in. Then we, in the axillary artery, as it passes the inferior border of our teres major muscle. Teres major muscle is the one that came off of the lateral border of the scapula and passed anterior to rotate the humerus. So now we're in the arm itself. And our word for arm is brachial. So this is the brachial artery.
Everything makes sense.
Next week, when we talk about blood pressure, it is the brachial artery that is being palpated. So you wrap the blood pressure cuff around and auscultated. When you wrap the blood pressure cuff around the brachial artery and pump the valve to pump air into it, the brachial artery is collapsed and no blood flow is passing through it. So when you listen with the stethoscope to the brachial artery distal to the cuff, you're not going to hear anything. Then as you open up the valve and gradually let air out of the cuff, that's going to decrease the pressure in the cuff, and eventually the pressure of the stroke volume of blood